something else we're talking about today. Do you ever wake up and you have like a jaw pain, but you don't know what caused it? You could be grinding your teeth at night, and it's a condition that is affecting right now more and more people out there.
Yeah, so celebrity cosmetic dentist Dr. Daniel Rubinshtein is here to talk to us about why it's happening and how to stop it. Welcome back to the show.
Thank you, ladies, for having me. And honestly, the amount of patients that are coming in with this problem is outrageous.
Okay, so how can someone tell if they're actually grinding their teeth, and how do you detect it in a patient?
Exactly. So what you guys could do is literally go to the mirror right now and just look at the edges of your teeth. People that grind their teeth, they tend to have worn down enamel, especially the canine, which is supposed to be the sharpest tooth in the mouth, becomes flat. And what happens is over time, it becomes flatter and flatter. Your teeth become smaller and thinner.
Oh, wow.
All right, so I think I know a partial answer to this, but why do people grind their teeth, and why is it becoming more prevalent?
Well, believe it or not, there's stresses in this world. I know you guys probably don't deal with stress. I'm just kidding. But stress is probably the #1 factor. And for some reason, our teeth get the brunt of the stress. So we let out all our stress on our teeth. So people that are more stressed, that maybe take certain medications that causes us to grind their teeth. People with sleep apnea. So people, when they're sleeping, they don't even notice that they're grinding. Sometimes I'll ask my patients, do you grind your teeth at night? They're like, I don't know. If you have trouble breathing, if you're snoring, it could be a sign of sleep apnea, and it could cause you to be grinding your teeth.
Okay, so doctor, have you seen an increase in the number of people who actually do this?
Tremendous amount of people are coming in now with more worn down teeth, with more broken teeth, chipped teeth because of their grinding. A lot of people are also grinding their teeth not only at nighttime, but if you're an active person, you go to the gym, you tend to clench and grind your teeth. So by you being healthy, it could also be detrimental to your teeth.
Well, let's talk about this beyond, cosmetic. What are some of the health complications that might be associated with doing this?
That's a great question. So many people, I don't know if you guys are one of them, when you wake up in the morning, some people have headaches, they have these muscle aches on their face, their neck hurts. So what happens is the muscles of your face, the masseter muscle, the temporalis muscle on your head, and the neck muscles, they're overworking. And the more they work, the more aches and problems you have. Those muscles are also attached to this joint called the TMJ, the temporal mandibular joint. And some people have problems opening their mouths. They feel pain in the joint area. So it can cause a lot of physical pain from grinding.
So I don't know if I suffer from grinding my teeth, but I have had a dream one time where I'm like eating like a burger and I bit my tongue in my sleep.
Oh my gosh.
Something associated with it.
Being starving at night.
I'm just hungry all the time. All right, does it go away, or is on its own, or are there ways to actually stop doing this?
That's a great question. So if it's an acute problem, meaning that it happened one time or 2 times, it could go away on its own. But if it's a chronic problem and you're an active grinder, the way that you find out if you're an active grinder, just ask your partner, if you have a partner next to you, if you're grinding your teeth at night, because it makes a lot of noise. It's not just like a silent thing that you do, it makes a lot of noise. So if you're an active grinder, you might need to loosen and relax the muscles. You might want to take muscle relaxers. You might want to do some Botox into the muscles. You might want an appliance that actually creates the ability for you not to be able to close down on your back teeth. Go to the dentist. That's the first step that you need to do.
Well, that's what I was going to ask you. At what point do you actually decide you should go see a doctor?
I mean, if your partner is complaining that you're making a lot of noise while you're sleeping, that's the first sign.
All right.
If you're starting to get constant aches on your face, on your head, on your neck, that's another sign. But if you're going to the dentist continuously, the dentist could pick it up on your routine checkups and cleanings. The dentist does these extra-oral exams so they can see if your muscles are getting stronger. It could see if there's any wear and tear of your teeth.
All right, good. That's good to know.
All right. Well, Dr. Rubinshtein, thank you so much for joining us again today to answer some questions about this growing dental issue.
May you guys have a stress-free day, and everyone watching as well.
All right, thank you.
All right, for more information, you can follow Dr. Daniel Rubinshtein on Instagram at @Dr_Rubinshtein.